Everyone, welcome to BMS with me. Today, let's continue with the topic abortion. In last lecture, we have learned about the definition, etiology, and two types of abortion, that is threatened abortion and inevitable abortion. Now here we'll be learning third type of abortion, that is complete abortion. Definition: when the products of conception are expelled en masse, it is called as complete miscarriage or abortion. Clinical features of complete abortion: there is a history of expulsion of a fleshy mass per vagina, followed by subsidence of abdominal pain. Vaginal bleeding becomes reduced or absent. Coming to the internal examination, uterus is smaller than the period of amenorrhea and it is little firmer. Cervical os is closed. Bleeding is traced. Examination of expelled fleshy mass is found in ultrasonography, that is transvaginal sonography reveals empty uterine cavity. Here the uterus is smaller than the period of amenorrhea, cervical os is closed, bleeding can be seen, examination of expelled fleshy mass is found complete, and in ultrasonography it reveals the empty uterine cavity. What is the management of complete abortion? First is, if the blood loss is there, then you can go for blood transfusion. Second, if there is doubt about complete expulsion of the products, uterine curettage should be done. Third is transvaginal sonography of the pelvis. It is useful to prevent the unnecessary surgical procedure. Fourth type of abortion, that is incomplete abortion. What is the definition? When the entire products of conception are not expelled, instead a part of it is left inside the uterine cavity, it is called as incomplete miscarriage or abortion. This is the commonest type met against women. What are the clinical features? History of expulsion of fleshy mass per vagina, followed by continuation of pain in the lower abdomen, that is pain is colicky in nature. Then there is a persistence of vaginal bleeding. Coming to the internal examination, uterus is smaller than the period of amenorrhea. Patelis cervical os often admitting tip of the finger. Third is varying amount of bleeding can be seen. Fourth is on examination the expelled mass is found incomplete. What are the complications of incomplete abortion? The products retained may cause profuse bleeding, sepsis, placental polyp, etc. What is the management of incomplete abortion? First is early abortion, dilatation and evacuation under general anesthesia. Late abortion, the uterus is evacuated under general anesthesia and the products are removed by own forceps or by blunt curette. Let us look into the fifth type of abortion, that is known as missed abortion. What is the definition? When the fetus is dead and retained inside the uterus for a variable period, it is called as missed abortion or early fetal demise. It is also called as silent miscarriage. What is the pathology here? The causes of prolonged retention of dead fetus in the uterus are not clear. Beyond 12 weeks, the retained fetus becomes macerated or mummified. Clinical features of missed abortion. The patient usually presents with the features of threatened miscarriage, followed by first is persistence of brownish vaginal discharge. Second is subsidence of pregnancy symptoms. Third is retrogression of breast changes. Fourth is cessation of uterine growth, which in fact becomes smaller in size. Fifth is non-audibility of the fetal heart sound. Sixth is cervix feels firm. Seventh is immunological test for the pregnancy becomes negative. Eighth is real-time sonography reveals an empty sac early in the pregnancy. Complications of missed abortion. First is psychological upset, second is infection, third is blood coagulation disorders, and fourth is postpartum hemorrhage. Now coming to the management. When the uterus is less than 12 weeks, vaginal evacuation is to be done without delay. It is done by suction evacuation or slow dilatation of the cervix by laminaria tent, followed by dilatation and evacuation. When uterus is more than 12 weeks, induction is done by the following methods. First is oxytocin. 10 to 20 units in 500 ml of normal saline at 30 drops per minute is started. If fails, escalating dose of oxytocin to maximum of 200 MIU per minute may be used. Second is prostaglandins. They are more effective than oxytocin. Example like prostaglandins, even misoprostol, 200 UG tablet is inserted into the posterior vaginal fornix for every 4 hours. Now, coming to the sixth, last classification of abortion, that is septic abortion. What is the definition? Any abortion associated with clinical evidences of infection of the uterus and its contents is called as septic abortion. Abortion is usually considered septic when there are, first one, rise of temperature of at least 100.4 degree Fahrenheit, that is about 38 degrees Celsius for 24 hours or more. Second is offensive or purulent vaginal discharge, which is seen. Third is other evidences of pelvic infection such as lower abdomen pain and tenderness. What is the mode of infection here? The microorganisms involved in the sepsis are usually those normally present in the vagina. The microorganisms are anaerobic, aerobic, and mixed. Anaerobic example streptococci, staphylococcus, tetanus bacillus, clostridium welchi. In aerobic like E. coli, staphylococcus, klebsiella. And mixed infection is more common. The increased association of sepsis is unsafe. In unsafe induced abortion is due to the fact that proper antiseptic and asepsis are not taken, incomplete evacuation, inadvertent injury to the genital organs and adjacent structures, particularly the bowels. What is the management here? First is hospitalization. Second is to take high vaginal or cervical swab. Third is vaginal examination. Fourth is overall assessment of the case. Fifth is investigation protocols. Sixth is principles of management are like to control sepsis, to remove the source of infection, to give supportive therapy to bring back the normal hemostatic and cellular metabolism. And last is to assess the response treatment. Based on grade of infection, the treatment given, like in grade 1, antibiotics, analgesics, sedatives, and blood transfusion can be given. In grade 2, antibiotics and antimicrobial therapy can be given. And in grade 3 infection, that is antibiotics, clinical monitoring, and supportive therapy can be administered.